The long-term conditions remit is very wide, so we're going to focus on certain specific disease areas and some cross-cutting themes. In particular, diabetes is one of our big projects, and we're going to look at primary care, community care, secondary care, to try to focus particularly on diabetes foot care, improving that, to increase the availability of diabetes specialist nurses, and to work on education both for patients, carers and for all our healthcare professionals. Diabetes care is a priority for Bristol CCG because our population has a large problem. We particularly have a problem around diabetes foot care. We have a higher than average across England rate of amputation, and we need to improve on this. We want to ensure that GPs and community staff have the right skills and knowledge to support patients in the decisions they make around self-management of their condition. We plan to review the cardiovascular services across Bristol, that's both heart disease and stroke. We want to improve the outcomes for patients with heart disease, and we need to access better opportunities for patients to understand their illness and manage it themselves. The cross-cutting themes of self-care and telemedicine will help patients in their understanding of their condition, improve their confidence in managing it themselves, and also improve the outcomes. These are a priority for Bristol because the people of Bristol are more likely than the average for England to die young from heart disease, stroke and cancer. And in particular, they're more likely, if they're diabetic, to undergo major amputations. We also want to address the inequalities that occur across Bristol. We have some populations that are at much higher risk, and we need to address this. We've re-established the Diabetes Clinical Network, and we have developed a Diabetes Programme Board to oversee the changes we want to see transforming diabetes services across Bristol. With regard to cardiovascular services, we're undergoing a review of current services so that we can progress to transform and improve cardiovascular outcomes for the people of Bristol. With regard to self-care, we have a self-care strategy, and we have projects working across Bristol in primary care and in secondary care to improve self-care amongst our patients and to support them in the decisions they make.